You have just learned that you are having surgery and probably have many questions about what to do to prepare for your procedure and anesthesia. This video is designed to give you information to help you know what to expect and what steps you can take to best prepare for your surgery and anesthesia. Before your surgery, a nurse will call you to conduct a pre-surgical screening. This will include gathering information about your health history and any medications that you are taking. They will provide important instructions about diet, which medications to take on the morning of surgery, and which medications to skip on the morning of surgery. Pre-surgery instructions also include to avoid wearing makeup, applying lotion, and to remove jewelry or any body piercings that you may have. It's also a good idea to leave any valuables at home, and you will want to wear comfortable, loose-fitting clothing on your day of the procedure. When you arrive on the day of your surgery, you will be checked into the preoperative holding area. A preoperative registered nurse will escort you back while your family member or support person remains in the waiting area. You will change into a hospital gown. Your vital signs will be taken, including your blood pressure, heart rate, and oxygen level. An intravenous or IV catheter will be placed typically in your hand or arm, and any necessary blood work will be collected. You will meet members of your perioperative team, which includes preoperative nurses, surgeons, anesthesiologists, certified registered nurse anesthetists, and operating room nurses. Each team member may ask you questions. Please be patient if these questions seem to be repeated. We do this on purpose to ensure your safety. An anesthesia provider, such as a physician anesthesiologist or a certified registered nurse anesthetist, will thoroughly interview you about your health history. You will also be asked if you or any blood relatives have ever had any problems with anesthesia. Other questions will include which prescribed medications, over-the-counter medications, herbal supplements, alcohol, or recreational drugs that you take. Your honesty is very important. Alcohol and recreational drugs can affect how you react to anesthesia and the type and amount you will need. Your anesthesia provider will explain your anesthesia options. These may include local anesthesia, regional anesthesia, or general anesthesia, or some combination of these. You will be given the opportunity to ask any questions and express any concerns. After your questions have been answered, you will review and sign an anesthesia consent form. Individuals with certain health conditions or who are undergoing particular procedures may be required to attend a pre-anesthesia testing appointment prior to the day of surgery. This is simply to identify any further testing needed, obtain lab work, and formulate the safest plan for you. Immediately prior to your transfer to the operating room, if appropriate, you may receive a medication in the preoperative holding area to help alleviate any anxiety that you may be experiencing. When you arrive in the operating room, you will be assisted to the surgery table and you will be connected to anesthesia monitors that will track your vital signs such as heart rate, blood pressure, carbon dioxide, and oxygen levels. These monitors allow your anesthesia provider to promptly recognize and treat changing conditions. Providing you with a high-quality and safe surgical experience is our top priority. If you are receiving a general anesthetic, a mask that delivers pure oxygen will be placed over your nose and mouth, and you will be asked to take several deep breaths. In most cases, medication that will place you into a deep sleep will be administered through the IV that was previously inserted into your vein during your preoperative preparation. After you are completely unaware and unconscious, a soft flexible tube or other breathing device will be placed through your mouth into your airway to assist with breathing during the procedure. A highly trained anesthesia professional will remain with you at all times throughout the procedure to ensure that you remain comfortable and that your well-being and safety are maintained. In most cases, the breathing device will be removed at the end of your procedure and you will be transported to the post-anesthesia care unit. Additional pain medication and any other treatments for your comfort will be administered. You will be closely monitored until you are ready to be discharged home or moved to your inpatient hospital room. In certain circumstances, it may be necessary for the breathing tube to remain in place after your procedure. If this is anticipated, it will be discussed with you before your surgery. Prior to your discharge home, postoperative instructions will be explained to you and your caretaker. We want you to know that anesthesia is very safe. The most common side effects of general anesthesia include nausea and vomiting and sore throat. Your anesthesia provider will take every precaution to administer medication to minimize these effects and will be available on the day of surgery to discuss the risks and benefits of the type of anesthesia that you will receive. Please do not eat or drink anything, including gum or mints, after midnight the night before your surgery. Eating or drinking too close to your scheduled surgery time will put you at an increased risk for vomiting and potential lung injury or infection. If you are instructed to take medication the morning of your surgery, you may do so with a small sip of water. If you are planning to return home on the day of your procedure, you must make sure that you have someone to drive you home and stay with you for 24 hours. If you will be using a driving service, you must have an additional adult accompany you during your ride. Please inform your surgeon or the preoperative staff prior to the day of your surgery if you have had any recent changes in health status, such as a fever, cold, productive cough, or any other concerns that you may have. Any medications that you are taking may need to be discontinued days or even weeks prior to your procedure, or continued on the morning of your surgery. So please discuss the appropriate course of action with your healthcare providers well in advance of the day of your procedure. If you are taking any recreational drugs, it is important that you stop taking them at least 2 weeks before your surgery. Please feel comfortable in being open and honest about your use with your providers so we can schedule a day that will optimize your safety. Many substances can interact with anesthesia and place you at a higher risk for serious complications. It is our main goal to ensure your comfort and safety. Highly trained, competent, caring anesthesia, surgical, and perioperative staff will care for you. At Truman Medical Center Health Sciences District, we appreciate the opportunity to provide your healthcare services and look forward to providing you with an exceptional surgical experience.